President Donald Trump signing an executive order today that he says will cut prescription drug prices. The administration's executive order would apply to a wide range of drugs and prices in the commercial market. It would include Medicare and Medicaid. The Department of Health and Human Services would work to negotiate lower drug prices. If that doesn't work, HHS would implement the most favored nation rule.
My administration will secure what we're calling most favored nations drug pricing. The principle is simple. Whatever the lowest price paid for a drug in other developed countries, that is the price that Americans will pay. And we're using the term other developed countries because there are some countries that need some additional help, and that's fine. I think that's very good.
The measure is expected to face significant legal challenges.
A live look over the U.S. Capitol, where Republicans have unveiled how much money they plan to cut from Medicaid. We first told you about this story overnight on the News 10 app. Under the proposal, Republicans would cut at least $880 billion over a 10-year period. There would also be new requirements for people enrolled. That includes working at least 80 hours a month and verifying their eligibility twice a year. Republicans say the budget cuts are necessary to decrease fraud and abuse and eliminate wasteful spending. But Democrats say if the legislation passes, more than 8.6 million people could lose access to health care. Today, the State Department of Health and Human Services announced it will offer virtual briefings so people on Medicaid can learn more about how federal cuts could affect them. Last week, the state offered 2 virtual Medicaid funding briefings. More than 5,000 people registered for the event. If you'd like to learn more, we have a link in our web story at WILX.com.